Hello, it's Desiree once again, and today I want to talk about antibiotics. Yes, antibiotics, because it is Antibiotic Awareness Week. And there's so many misconceptions and misunderstanding about antibiotics that I think we need to set a few things straight. Thing number one, antibiotics are really critical medications. They save lives, but we're edging towards a future where these really important medications may no longer work. Why? Overprescription and antibiotic resistance, which we'll talk about in a sec. I want to share a stat that will probably surprise you. So in Canada, we have less than 40 million people in our country, right? But every year, 25 million prescriptions for antibiotics are filed, which is kind of astounding, particularly because antibiotics don't work for all things. Classic example is cold and flu season. Common cold and influenza are caused by viruses. So antibiotics aren't going to do a thing for them, but so many of us go to our doctor asking for an antibiotic if we have the common cold. Not gonna work. Instead, if you have an ear infection, strep throat, then you want to talk to your doctor because those are typically caused by bacteria. Antibiotics for bacterial infections. Viral stuff, no go. So how do bacteria get resistant to antibiotics? Well, a big thing is that antibiotics rarely kill 100% of bacteria. So the bacteria that are left, well, they won the genetic lottery, didn't they? And the crazy thing about bacteria is that they replicate really quickly, but they also sort of play loose and fast with their genetic material, which means if bacteria A is resistant to that antibiotic, it can share those genes of resistance with bacteria B. If you do this over lots of generations and life cycles, you end up with a whole bunch of different kinds of bacteria that are actually antibiotic resistant, which is what's endangering the effectiveness of antibiotics in modern medicine. So really important. Do all bugs need drugs? Nope, not necessarily. Make sure you're getting the right drug for the right bug. The other thing that happens when we take antibiotics is that they kill the good with the bad. So we need them to kill the bad, but then they also kill the good. And when it comes to our gut microbiome, that's a really negative thing because when we kill off a bunch of our healthy bacteria, it creates this vacuum essentially of good bacteria where the opportunistic pathogens can take over. What's an opportunistic pathogen? Exactly how it sounds. Something that when it has the opportunity, it can be pathogenic. Pathogen also means disease, right? Makes sense. So, and all of us have some of these opportunistic pathogens in a normal healthy gut. They just never get the chance to take over because our healthy microbiome is keeping them down. But an antibiotic can sort of reverse that balance. And 1 in 5 folks might actually suffer side effects from taking antibiotic use. And the side effects don't actually come from the medication themselves. They come from these opportunistic pathogens taking over the gut and causing all sorts of nastiness like gas, bloating, abdominal pain, or even diarrhea. In fact, antibiotic-associated diarrhea is the #1 side effect of antibiotic use. So if you need antibiotics, what do you do to help prevent that? Well, you take a probiotic, but not just any probiotic, a probiotic that has clinical evidence to show that when you take it alongside an antibiotic, it helps to decrease the incidence of antibiotic-associated diarrhea. And guess what? BioK Plus has that evidence. It is clinically verified to work alongside antibiotics to help decrease your risk of antibiotic-associated diarrhea. So in Canada, you have the Strong or Antibiofix, which is a 50 billion capsule. And in the US, you have the new Biome Pro, same 50 billion capsule with a delayed release capsule and, fancy American packaging. So how do you take these to help prevent AAD? What you want to do is take them every single day you're taking antibiotics plus 5 days after. That's what was done in the clinical trials. The other thing you want to remember is that you want to take your antibiotic, wait 2 hours, and then take your BioK. You want that antibiotic to sort of move through your system before you give it the probiotic. So remember, every day of your antibiotics plus 5 days after to help you prevent the side effects of antibiotic use.